Now today we will be talking about constipation. Now we must know constipation is extremely common problem. But how do we define it? How do we actually come to know that the patient really has constipation? Now as per Rome 4 criteria, patient must fulfill one of these symptoms, then we can definitely label that the patient has constipation. The first one is that there must be incomplete evacuation of stool. So whenever the patient is going for the loo, whenever his patient is going to pass the stool, then almost always the patient doesn't feel that his abdomen is completely uh, flushed. So the patient complains that the patient keep on going for latrine multiple times, but he doesn't get complete satisfaction, so that there is always some stool remaining. So patient has to go again and again and again to pass the stool. So the patient may go once, twice, three times, four times, five times also, but there will be incomplete evacuation of the stool. So the patient doesn't feel that completeness. So this is the first criteria of constipation. Second thing, very commonly patients, most of the time, most of the people pass at least stool once per day, but these patients who do have constipation usually may not pass stool at least 3 times a week, so that the patient may not pass stool for maybe around 2 days. So patient will pass stool only in less than 3 times in a week, means only less than 3 in 7 days. So this is one more criteria for constipation. Third thing is, the patient very commonly feel that there is a feeling of pelvic impaction. Pelvic impaction means what? The patient should completely pass the stool which is there in the gut, but because of the whatever problem or because of the constipation, the stool is not completely passed. The patient go to pass the stool, the patient go to the loo, but they don't pass the stool. So they feel that there is, the stool is impacted in the gut, in the pelvis, actually in the lower abdomen. So this is the third criteria for labeling the patient that the patient has constipation. Fourth thing is, these patients or many of the patients, they don't pass a soft quality stool. So what they pass is, they pass hard and lumpy stool. Actually the patient should pass a very soft stool which should go which should come out of the anus very easily, but these patients will not pass that soft stool. These patients will pass a very hard and lumpy stool, which is one of the criteria for saying that the patient has constipation. The fifth criteria is that there is, the patient has history of straining in more than 25% of their stool. So it is very commonly seen that these patients go to the toilets to pass the stool, and they almost always have to push so much hard, so that many of the times it is painful, or many of the times they have to strain a lot to make sure that this stool come out of their anus. So without this training they cannot pass this stool. So this training has to be for more than 25% of their stool. And the last is the manual evacuation of the stool. This is one of the very important criteria, as this stool is so hard, or many of the time the pressure that they give, the strain that they give is very commonly insufficient, and the stool which is impacted here doesn't come at all. So what they do is, they have to put their fingers and they have to remove bits and bits of this stool. So they remove some part of the stool, and after that, once this impacted stool in the anus is removed, in the rectum is removed, then they can pass the remaining portion of the stool. So these are the all six criterias which defines that the patient has constipation. Thank you.